I'm Andreas Kremer. I'm a professor of hepatology, gastroenterologist and hepatologist by training, and currently head of hepatology at the University Hospital in Zurich, Switzerland. GLISTEN was the so far largest phase 3 study addressing symptom burden in patients with primary biliary cholangitis. Patients with moderate to severe pruritus were randomized to either the IBAT inhibitor linerixibat, given twice daily at 40 milligrams, compared to placebo. The primary endpoint, namely the worst itch monthly score, was significantly improved after 24 weeks of treatment. Important to say that the efficacy was already achieved after 2 weeks of treatment, indicating a rapid response in patients on the IBAT inhibitor treatment. A side improvement of pruritus, also sleep interference, was significantly improved, which is reassuring. This post-hoc analysis investigated pharmacodynamic parameters of IBAT inhibition as well as potential biomarker analyses for pruritus. The mode of action of IBAT inhibition is to reduce the reuptake of bile acids in the terminal ileum. Thereby, less FXR activation takes place and less FGF19 production will take place, which was found to be also present in our patients being treated with linerixibat, which had a significant drop of FGF19 levels. Accordingly, we see less inhibition of bile acid de novo synthesis, meaning that C4 as a biomarker of bile acid novosis in the hepatocyte was increased in patients on IBAT inhibition. The biomarkers for pruritus were all significantly down. Aside the levels of serum bile acids dropped, also autotaxin and interleukin-31, which seems to be an FXR-driven potential pruritogen in liver disease, was also significantly down during the treatment with IBAT inhibition and went up when, at the end of the study, a switch took place from linerixibat to placebo for a couple of further weeks, which is reassuring that IBAT inhibition works not only on symptom burden but also on potential biomarkers, and thereby we have a clear-cut explanation for this mode of action on symptom burden, which is very commonly observed in our patients. Roughly 50 up to 80% suffer from pruritus during the course of their disease. The take-home message of this study is that IBAT inhibition, in this case linerixibat, improved significantly symptom burden, and the pharmacodynamic parameters of reduced bile acid uptakes were clearly shown by reduced FGF19 levels and increased C4 levels, representing an increased de novo synthesis of bile acids within the liver of these patients. Aside these pharmacodynamic parameters, also potential biomarkers of pruritus, aside a reduction in total serum bile acids, we observed reduced autotaxin and AASLD levels, which have been reported to mediate pruritus in patients with cholestatic liver diseases.